Hey y'all, it's Super Mama Sunday and we are talking all about safe medications in this series. Today I want to talk about something that I really feel passionate about, and that is mental health medications in pregnancy. So make sure you keep watching so you can get all the details. All right, Super Mamas, so let's talk about mental health. So this is something I feel really passionate about. I did a lot of additional training in mental health during pregnancy because this can be such a huge issue for a lot of women. Many women are dealing with depression and anxiety and other mood disorders before they even get pregnant. And so the pregnancy can really make symptoms worse, not only because of the hormones that you are emitting during pregnancy, but also because of all the big life changes. You know, certainly if you're sick every morning, you're not feeling well, or your body is changing, or you have a pregnancy that you didn't plan and you're trying to figure out how you're going to do all this, mental health in pregnancy is just such a big deal. So I want to talk to you mamas who maybe have been on medication in the past for depression or anxiety or bipolar disorder or schizophrenia. And for those who may have been suffering with mood disorders and who have never been treated. It is so important that at this time in your life that you are having treatment for mental health disorders. One of the things that I like to do is to screen every mama at her very first visit for depression and anxiety, and then to screen them again right at the beginning of third trimester, and then again right after they have their babies. So I'm always on the lookout for this because this is something that is so prevalent. Probably about 25% of moms, that's 1 in 4 moms, is going to deal with depression, anxiety, or another mood disorder. And we refer to these as perinatal mood and anxiety disorders, or PMADs for short. So let's talk pre-pregnancy. If you have been on medication for depression or anxiety prior to becoming pregnant, very, very, very important that you search out an OB who is comfortable handling your mental health meds. And that might take a little bit of searching, but there is a movement going on across the country for providers who are working with moms to begin to take additional education. This is called a perinatal mental health certification, and you can get this by taking additional coursework in therapy and also in the medications that can be safely used in pregnancy to treat mood disorders. So I actually did that, and my other practice partner, my nurse practitioner, has done that course, and it really opened my eyes to how undertreated pregnant women are when it comes to their mental health, particularly Black women. And I recently did a study to see how my patients were reacting to a positive screen for depression or anxiety. And so many times patients admitted it, but very few were actually willing to go and seek counseling, and very few were actually willing to start medication. And a lot of that was because they were worried about the pregnancy. So let me just talk real with you guys for a minute. There are several medications that are safe to remain on or to start during your pregnancy for mental health. And I think it's so important to talk about this with your OB care provider. I also think that we got to be real with ourselves. So if we're not in a good place mentally and emotionally, believe it or not, this has a physical effect on us, and it can dysregulate your hormonal axis. That is so important during your pregnancy. We've seen women who have depression and anxiety and other mood disorders have an increased risk for preterm birth, for low birth weight, even for things like maternal suicide. And that is just such a shame. We can do better. So I think that, screening for these disorders, and if your provider doesn't screen you or give you, quizzes to see if you're having problems with anxiety or depression, you need to bring it up, because preterm birth is a serious thing. Low birth weight is a serious thing. We also know that hypertensive disorders in pregnancy, like preeclampsia, can be higher in women who are experiencing experiencing mental and emotional stress, as well as gestational diabetes. And that's because when we are stressed for long periods of time, our body is making the hormone cortisol. And cortisol causes an increase in your blood sugar, it can cause an increase in your blood pressure, and it really can throw off your other hormonal balances. The other interesting thing I want to share with you is that while we've seen that long-term depression and anxiety has caused all of these different things that I mentioned, preterm birth, low birth weight, preeclampsia and hypertensive disorders, also gestational diabetes and real severe mental illness, we have not seen that medication, those medications that are safe for pregnancy, have not caused those. We have not seen an increase in preterm birth in moms who are treated. And guess what? When we've studied these medications in countless studies, we have not seen that these medications cause any of that laundry list of things I just named. Some babies showed a slightly lower birth weight when their moms were on antidepressant or anti-anxiety medications, but they did just fine and they were healthy. So I think that that risk of medication is actually lower than the risk of going through your entire pregnancy mentally and emotionally unwell. In addition, it can be very difficult to look forward to birth with joy and anticipation if you are really having a hard time with generalized anxiety or with depression. Women who are dealing with depression and anxiety are less likely to get appropriate prenatal care because sometimes they just can't get up and get out of the bed and make it to their appointments. Also, bonding with baby after it's born can be very difficult for these women who have untreated mood disorders. So there's so many ramifications when your mind is not right, and we need to get that mind right in order for you to get the rest of your health right. So I urge you, if you have a problem with depression or anxiety, or you feel like things have been just kind of building for a long time, talk about this with your OB. Ideally, you would have a preconception visit where you find an OB that you feel comfortable with and you talk to them about your desire to become pregnant, the medications that you're on, and what a plan would be for you if you were to become pregnant. If you don't make it to the preconception visit and you just find out that you're pregnant and it's unplanned, that's okay, girl. Go ahead and find someone that you feel comfortable talking to, that you feel will be able to manage your medications, or even if you have an OB and a psychiatrist who you feel comfortable with, that's also an acceptable plan. But talk about it, talk about it, talk about it. Continue talking about it until you get the help you need, because you know why? With the right help, you will feel better. So to answer the biggest question out there, will mental health meds hurt my baby? And the answer that I give my patients is that there are risks and benefits for everything, but there is a much longer list of risks for babies who are exposed to your mental health disorder versus babies who are exposed to medication. And a caveat to this is that you need to be adequately treated, right? Because if you're taking the tiniest dose of Zoloft, for instance, which is usually our go-to medication in pregnancy, and you're not getting good relief, well, guess what? Now you're exposing the baby to the medication on one hand, and you're exposing them to your mental illness on the other hand. So if you're going to be treated, be committed to being adequately treated. And most of the moms that I serve are gonna find a sweet spot on their Zoloft, like between 1 and 200 milligrams per day. And that might sound like a big dose, because I know for me, even before I got this additional training in perinatal mental health, I was giving people really small doses of Zoloft, but it wasn't even enough to really help. So I learned so much by going and getting additional training. And I think it's okay to suggest to your OB provider that, hey, I heard that the maximum dose of Zoloft is 300 and I'm only on 25, or I'm only on 50 and I'm not really feeling much better. Is there something that we can do about that? And if your OB doesn't feel comfortable managing mental health meds, and a lot of OBs do not, then go ahead and ask for a referral to a psychiatrist. There are even psychiatrists who specialize in working with moms. And so don't stop talking about it. Don't stop asking questions until you get the help that you need. As I just mentioned, Zoloft is the go-to medication in pregnancy. It's been very well studied, and we think that its safety profile is very good, but there are also other medications. So let's say you were on Prozac, or you were taking Lexapro, or you were taking some of the other SSRI medications, and SSRI stands for Selective Serotonin Reuptake Inhibitor. There are lots of medications that have, not been shown to cause birth defects, and that women have taken safely throughout their pregnancy. So very important to just talk with your OB care provider or with your psychiatrist about managing your medications during your pregnancy. And, we're always, again, weighing those risks and benefits. And like I said, the risks of, having a pregnancy where you are not mentally well versus the risks of being on medication and being treated, benefits of being treated with medication and counseling or both is just so much higher than the risks associated with most medications that we use for mental health care. If you have been under a doctor's care and you are being treated with medication for depression, anxiety, or bipolar disorder, make sure that you talk with your OB care provider and with your mental health care provider about pregnancy so that you can understand what you need to do with those meds. It is almost never correct to just stop your meds cold turkey. So if you become pregnant, go ahead and have a talk with those individuals. Let them know that you need to discuss medication because you found out that you're pregnant. The American College of OBGYN says that if you're stable on a medication, the likelihood is that you should remain on it. So don't just stop it cold turkey. There are only a few mental health meds that we don't use in pregnancy, and there are usually alternatives for those. And so there are lots of combinations of things that we can use to help you with depression, anxiety, or other mood disorders. So I'll say this again, I know I sound like a broken record, but look, keep talking about it, keep asking about it, keep searching for the right help, because with the right help, you can be better, you can feel better, you can enjoy and embrace motherhood, and you can begin to look forward to bonding with your baby, being able to share those special early moments of a child's life, because we know that if you don't bond well with your baby in the first 6 months, it can really have long-term impact. So if you recently had a baby and you know that there is something wrong, you know that you are feeling anxiety or depression, or you're having problems with other mood disorders, it's important to get treated because you don't want to miss these special moments. If you have thought about harming yourself or harming your baby or harming anyone else, that is a mental health emergency, and you need to report to a mental health clinic or in a hospital emergency room right away. Maternal suicide is real, y'all, and there's nothing more tragic than when a mom takes her own life. So make sure that you are talking to your healthcare provider if you're having thoughts of self-harm, if you are doing things to harm yourself, or if you're doing things to harm your baby. So I hope today's video was helpful for you. If you are a woman dealing with mental health issues and you're pregnant or you've recently birthed your baby, so important to talk about this. Keep talking until you can get the right person to listen, because with the right help, you will get better. All right, super mamas, I'll catch you next Sunday. Peace.